Question for you, Minister. A lot of people are kind of looking at this and wondering how some of this makes sense. So if I'm an unvaccinated individual, I can't go into a restaurant, I can go to the patio. But if I need to use the washroom or pay, I can go into the restaurant. Is there going to be somebody in that restaurant minding where I go after I go into the washroom?
Well, I think to explain the consistency for this, I would refer this to Dr. Moore.
Thanks very much for the question. It really depends upon the risk associated with an individual. So we have always assumed outdoors is safer than indoors. If you go indoors and it's less than 15 minutes, the risk of exposures to others is much less. You also, as you go indoors, will be wearing a mask. So our typical contact tracing is 15 minutes or less would not be a high-risk contact, even if you had COVID. And so hence the reason short visits indoors to a washroom to pay a bill are allowed, and no one's going to be monitoring that exact amount of time. It's based on best evidence. It's also based on some assumptions that it will be 15 minutes or less, and that you'll be masked in that environment.
And I just wanted to ask a question about enforcement of all of this. I know the Solicitor General is obviously not here. There are a lot of businesses who are already saying we're not going to partake in this, particularly gyms who are saying already we are not going to ask people for their vaccine status. What level of monitoring is the province doing about these businesses, and how will it be enforced? Because it seems like the enforcement right now is at the point of a disagreement, not necessarily proactively seeking out businesses that are saying we're not going to participate in this. This is for the Deputy Premier, if you don't mind.
Sorry.
Thank you. Well, this is required, and there will be bylaw enforcement officers that will be available, that will be doing a lot of the monitoring there and making sure that businesses conform, as we're expecting individuals to conform to the requirements. And on the other side of it, if there are any businesses that are concerned that when they refuse entry to a restaurant, a gym, or whatever it happens to be, that if any point they feel threatened, we want them to call 911 as soon as possible to make sure that our police officers can be there to assist. We want to make sure that everyone conforms to these rules, but if anyone feels threatened, we do have the facilities available for people to seek help.
Sorry, Minister, just to follow up on that, that's going to be a lot of 911 calls. How do you balance all these people calling, or businesses calling 911 over an unvaccinated individual versus somebody who legitimately needs ambulatory services? Is there more money going to these services to ensure that they can keep up with the increased demand?
I don't anticipate the demand is going to be huge because we're asking people to be reasonable. We have let people know what the requirements are well in advance of the changes being made. People do have until September 22nd to be vaccinated. We are encouraging everyone who is able to be vaccinated to please go out and do so. If you have concerns, please reach out to your primary care provider to discuss that with them to determine if there is a reason why you should not be vaccinated. But most can be vaccinated, and we're asking them to do that. And again, asking people to be reasonable, please follow the rules. Again, I don't anticipate there will be huge calls, 911 calls, for that reason, that people understand what the rules are, and we're simply expecting people will follow them.
Hi, Minister. This morning during the technical briefing, a lot of journalists pointed out that it wouldn't be too hard to get a fake doctor's note for, claiming medical exemption. And the response from the ministry was, well, fraud is definitely a possibility. Is this something that is of concern to you? And are you going to do anything to address that?
Well, we certainly anticipate that won't happen. There may be some situations where it does, but that's only going to be for the period from September 22nd to October 22nd, when the medical exemption will be imprinted into the QR code. But I would ask perhaps Minister Rashid to speak to the more specific issues around that.
Thank you very much, and thank you for the question. Yes, so we are actually working on the QR code, as mentioned earlier, that these are some of the guidelines in terms of medical exemptions that eventually will be input into the QR system. And this way, the businesses, when they are scanning the QR code will be able to receive the message in terms of whether the individual is eligible to enter the establishment or not. Thank you.
My follow-up is for the Deputy Premier. There's been a lot of talk about the creation of safe zones around hospitals. Yesterday I was at covering the protest at Toronto General. I saw several patients having to be escorted by police officers through the crowd. So is this something that your government is ready to legislate on or get tougher on to protect healthcare workers and patients who are coming in and out of the hospital?
Well, I know there has been some discussion about safe zones. We would have to see what the people who have raised it would actually have in mind before we could say yes to any of that. But right now, what we are looking at is to ask people to make sure that if they are protesting, if it's a peaceful protest and they're not interfering with the hospital's operations or people's ability, staff or patients, to come and go inside or outside the hospital, then we are going to work with our police officers as well. They're monitoring the situation as well. If there's some indication that there is any problem with people having that access, then the police officers will take the appropriate action. But we are asking people that if you wish to protest, certainly you may do so, but do not interfere with the hospital's operations. And I would also say that this is very, very demoralizing to our frontline healthcare workers who've been working flat out to save people's lives for the last 18 months. And so I think it's just very unfortunate that this is happening with the protesters, and we would please ask them to think about the great work that our frontline healthcare workers are doing, and please stop these protests because they're really very discouraging to our frontline healthcare workers.
We'll go to the phone lines. Just a reminder, one question, one follow-up.
Your first question comes from Matthew Bingley with Global News. Please go ahead.
Hi, Matthew.
Hi, Minister. I'm just wondering, when it comes to the medical exemption notice, on the technical briefing we heard that there was a sample that was going to be sent out to doctors if they choose to use it, but it's not being required. I'm just wondering why that decision was made to not have a simple form to actually make sure that there is no fraud when it comes to these notes being written.
I'm going to refer that to Dr. Moore. Thank you.
Thank you very much for that question. So, very pleased that the Registrar for the College of Physicians and Surgeons of Ontario has come out with guidance on medical exemptions for COVID-19 vaccination. The Registrar has identified two and has communicated that to all physicians in Ontario. The first being a severe allergic reaction to any of the components confirmed by an allergist. The second being inflammation to the heart, the sac around the heart called myocarditis or pericarditis. Those are the two major medical exemptions that have been identified to date. There may be a third category associated with adverse event following immunization for specific neurologic or other ongoing symptoms, but those would be investigated by specialists. So very, very few exemptions that are listed, and the Registrar has defined that you must put the exact reason for medical exemption, as well as the duration that medical exemption should be in place, as well as identify yourself and your college identification. So there are forms that will standardize this for nurse practitioners as well as physicians, and a standardized exemption format. If there is abuse of this by physicians or nurses of the extended class, there may be professional discipline for them. And if there's fraud, there is a process through the reopening of Ontario Act enforcement that can deal with the fraud aspect.
Follow-up?
Yeah, and perhaps this is for Minister Rashid. I'm just wondering, earlier he said that come October 22nd, there's the possibility of using either the digital side or the paper option that will be on beginning next week. But when you were specifically talking about the QR code that will be given for those medical exemptions, will people with those be required to use the digital system, or is there still an option to go back and forth?
I believe when we look into the QR code, the medical exemption is going to be embedded. It's the data that we are taking from the Ministry of Health and putting into the QR code system. And eventually, yes, I mean, if somebody doesn't want to use the QR code because people have the choice, then I'm sure at some point Ministry of Health will be looking into issuing an exemption certificate. But from a technological side, the QR code eventually will have a system in place that will allow for medical exemptions to be embedded into the QR code system.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Hello, everyone. I'm just a little, could use a little bit of clarification on the medical exemption forms. Dr. Moore was just saying that if anyone is abusing these on the medical side, like giving an exemption where it's not warranted, there could be professional discipline. How will that get discovered? Would that get discovered if a doctor's or a nurse practitioner's practice is being audited? Because otherwise, I think these letters would be, or the details would just be between the doctor and the patient.
Well, they will be reviewed. There will be, as the things are uploaded to the code, the QR code, that there will be some review of what's going on. I think I would refer that to Minister Rashid to answer specifically how that would be dealt with.